Hello everyone. Today we will discussing the basic instruments used in the ear, nose and throat. The first instrument we will discussing about the head mirror. This is the headband and this is the mirror. The mirror is concave mirror. The focal length of this mirror is 25 centimeter. The diameter of this mirror is 89 millimeter. This is the inner hole. The diameter of this hole is 19 millimeter. There are basic mistakes done by the student in holding the mirror, holding this mirror. They commonly hold like they place the mirror part on the center of the forehead or on the left side of the eye. It's not like that. The commonly used position for this mirror is on the right side of the eye. And another mistake is done by the students. They close one eye and look with the one eye through this hole. It is not like that. Look with the both eyes, and the vision should be a binocular. The another instruments we will discussing is commonly used is Thoradicum's nasal speculum. This is used for the visualization of the nasal cavity. The uses of these instruments in anterior rhinoscopy, removal of the foreign body, for the packing of the nasal cavity, and for in the septal surgeries. The how to hold these instruments. This is for the students is a difficult part. This is hold like this. The bend or the index finger placed on the bend of the index finger. The prongs should be towards you. The middle and the ring finger on the limbs of this speculum, and this should be like that. Ideally this instrument is used in the nasal cavity in closed position and removed in the semi-closed position to avoid the plucking of the hairs. The procedure of the anterior rhinoscopy is already I discussed. It is available on the YouTube. You go through that. The another instrument is tongue depressor. The name of this tongue depressor is lax tongue depressor. This is used for the examination of the oral cavity and for the posterior rhinoscopy. This is held in the non-dominant hand. The dominant hand is free for the manipulation. Another instrument is indirect laryngoscopic mirror. It is not an indirect laryngoscopy. Indirect laryngoscopy is different thing. Indirect laryngoscopic mirror is different thing. This is the indirect laryngoscopic mirror, not indirect laryngoscope. They are available in the various size. The mirror of this different size. This is used for the very important procedure, anterior indirect laryngoscopy. The procedure is called as indirect laryngoscopy. This is performed by the help of this mirror. The procedure of indirect laryngoscopy. How to perform indirect laryngoscopy? What are the precautions? What is the procedure? I will already uploaded a video on the my YouTube channel. You go through that for the indirect laryngoscopy. The another instrument is posterior rhinoscopic mirror. This one is the anterior rhinoscopic mirror. This one is the posterior. The difference is the indirect laryngoscopic mirror is straight, and the posterior rhinoscopic mirror is curved, angulated. The angle is approximately 120 to 130 degree. This is used for the posterior rhinoscopy. The another instrument is used in the posterior rhinoscopy is tongue depressor. The procedure of the posterior rhinoscopy, how to perform the posterior rhinoscopy, what are the precautions, is already uploaded on the YouTube channel. Go through that. The next instrument we will discussing is eustachian tube catheter. The total length of this catheter is approximately 12 to 15 centimeter. This is used previously used for the performing the eustachian tube patency, but presently we not used for the patency of the eustachian tube because this is a non-invasive, it's an invasive procedure which may lead to the injuries in the nose. The another uses of this instrument is for the removal of the nasal foreign body, for installation of the medications in the middle ear, for inflate the middle ear, and for the suction of the also used for the suction of the nasal cavity. The procedure of the how to perform the eustachian tube catheterization is available on my channel. Go through that. The another frequently asked instrument is Jobson's Horny probe. This probe has two ends. One is on one end there is a ring, on the another end is a serrated. The ring end is used for the removal of the foreign body bags from the ear, for the removal of the granulations from the externality canal, and the serrated end is used for the mopping of the externality canal ear, the nasal cavity. We place a swab or cotton swab on this serrated end and we clean the externality canal. The next instrument used is the tuning fork. Tuning fork is very important instrument, and the test performed by this instrument, the tuning fork test, is very frequently asked in the viva. First we will discover the parts of the tuning fork. This is the base or foot plate of the tuning fork. This is the stem of the tuning fork. These are the shoulders, and these are the prongs of the tuning fork. What are the tuning fork test? How to perform the tuning fork test? All these are available on my YouTube channel. You should go through that. Basically this instrument is used for the assessment of the clinical assessment of the hearing and the type of the hearing loss. This is not commonly asked with the undergraduate students. This is the otoscope. This is used for the examination of the external canal and the tympanic membrane. With this help of this instrument, we see the magnified view of the tympanic membrane. And for the examination of the right side of the ear, we hold in the right hand, hold like a pen. And for examination of the left ear, we hold in the left hand. Another instrument is pneumatic bulb. This is used for the increasing the pressure, changes in the pressure in the external canal, or for the checking the mobility of the tympanic membrane. There is a port in the otoscope where it should be inserted and change the pressure in the external canal. We perform the test like a chair to a fistula test and look for the mobility of the tympanic membrane. Another instrument is commonly used is the Tilly's forceps. This forceps, there is a serration on the anterior end of this forceps. This is commonly used for the packing and unpacking of the ear, mastoid cavity, nasal cavity, and for the removal of the foreign bodies from the ear and the nose. Thank you guys. This is a short video on the commonly used instrument in the ENT clinical practice or in a practical vibers. The other instruments which we will discuss in the further lectures. Thank you.